Hello everyone and welcome to this short episode of introducing ERCPMP, an endoscopic image and video dataset for colorectal polyps morphology and pathology. Here I'm hosting this episode with a special guest, Dr. Mojgan Forootan, Professor of Gastroenterology, and I'm really honored to have her in this episode for more discussion in details for medicine doctors and specialists and also artificial intelligence scientists who are interested. I'm Hamid Reza Bolhassani, PhD and Chief Data Scientist of Databiox. In the recent years, the interest in artificial intelligence and its leading subtypes like machine learning and deep learning is becoming very high, and many scientists in various aspects are taking care of these areas, especially in medical science. Right now, many algorithms are getting developed for prediction, early detection, diagnosis, treatment, and prognosis. In this episode, we are focusing on ERCPMP, which is a data set for colorectal polyps morphology and pathology. So why taking care of this data set? Because the most important challenge for training deep neural networks is data, and as much as we have good data, we can train more accurate algorithms. As you can see, we have many types of images and data in clinical and medical sciences, and one of the interesting one that today we also discuss is endoscopy and colonoscopy images. So let me introduce the special guest, Dr. Mojgan Forootan, Professor of Gastroenterology of SPMU University. Hello, Dr. Forootan, and welcome to this episode. I'd like to discuss for us about this episode and also this dataset.
Thanks, Professor Bolhassani. Our work is about an endoscopic image and video dataset for colorectal polyps morphology and pathology. We have published the preprint of this paper and is accessible for everyone who are interested. These are the pictures of our respected colleagues and professors. This dataset contains demographic, morphological, and pathological data, endoscopic images, and video of 191 patients with colorectal polyps. Morphological data is included based on the latest international gastroenterology classification references, such as Harris classification, Pitt pattern, and JNet classification. In the next episode, we will discuss the details of this classification more. Pathological data includes tubular villus, tubulovillus, hyperplastic, serrated, inflammatory, and adenocarcinoma with dysplasia grade and differentiation. Hereby, I'd like to appreciate Dr. Elham Amjadi, anatomical pathologist, who help us for gathering some of these nice pathological images. The current version of this dataset is published and available on Elsevier, and since it is under development, the latest version is accessible via databiox.com.
Okay, thank you very much, Dr. Forootan. Many thanks for your nice presentation. And thank you everybody for your time and watching this episode. I hope it was useful and informative for you, and hope to see you in the next videos. Bye.